tue, ça blesse, ça flingue. Hey, 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 wow. Gazo.
Hey everyone, how are y'all? I'm Shelly, the host of Unmasked Health. This is a new podcast that is recently launching, and I just kind of wanted to touch base on why I created Unmasked Health. I did have some help, a lot of pushing, so I'm finally here. And why Unmasked Health? Um, Most of what I will be discussing is on men's health. Men ignore their health, or they're told you can't show weakness, can't cry, you can't be a wuss, whatever. And so I have been in the healthcare field for over 20 years. I have been a healthcare provider, nurse practitioner for the last 8 years at least. And I've been in private practice for the last 3 years. And so when I started in private practice, I realized that I had a lot more women patients than I did men. And the men that were coming in were just coming in when things were just really bad. And so I got to paying attention to, why aren't men coming? Like, how do I draw more men in to get the care that I know that they likely need, even if it's just mental health? So Unmasked Health was created to unmask the reality of men's health. Um, there's no gimmicks here. There's, a lot of what I talk about, and I'm going to have a co-host who will come in and help with some material. I will have, special guests on here from different specialties like urology, cardiology, mental health specialist, a fitness specialist. But my main goal is just to be raw and unedited with mainly men, but it includes women also because I am a woman and I talk from a woman's viewpoint. However, I talk from a provider viewpoint, from somebody that's in healthcare. Men often put off their health because they don't want to miss work. You've been told, hey, you're supposed to be the breadwinner. You're supposed to go to work. 3 years down the road, you've run into a huge problem when, 3 years prior, you could have hit something head on. We're going to talk about everything from testosterone to preventative screenings to mental health to sexual health to anything that anybody wants me to discuss, as long as it's palatable. Um, but I'm very blunt and honest with what I know. I practice based off of evidence based practices and guidelines. And but I also realize that not every patient can be put into the same cookie cutter. That's a lot of the problem that some of us have run into when I've had patients come in. The first thing out of their mouth is, nobody wants to listen to me. And so you have to break down the barriers, and we have to, as healthcare people, have to get out of silos that not everybody's going to fit into that perfect little cookie cutter. Men are one, I think a lot of it is pride, and that you feel invincible, and that, hey, that's okay if you feel that way. I'm game for that, but let's be invincible and take charge of your health. I will have a patient on who I started taking care of approximately 2 years ago, and he's gonna, join and talk about his experience with me as his provider, and his uncomfortable situations that he encountered coming there, because that's a lot of it, right? A lot of men go and they don't want to talk about something's going on with them because it's embarrassing. But he's going to kind of talk to you about that, and he's going to share his experience and what has improved or not improved for him. He's truthful, honest, and I mean, he's a good guy all the way around, so I think you'll really enjoy him. But the reason why I really wanted to create this podcast or this talk, or whatever, TED Talk if you want to call it that, is because I'm going to be ripping the Band-Aid off discussion topics that, yes, there are plenty of great speakers out there, great podcasts out there. A lot of them are out there, um, and I'm all for, I support every one of them. I feel like there's just a space for me to come in now and share my viewpoint, my experience, my medical professional, experience and opinions, and take on the male as a whole and women. You have to have women are just as much a part as a man's health as anything. So let's just all jump in together and address it together, right? So hopefully you will enjoy every single episode. I would appreciate any comments, feedback, subscribing, of course. And if you want me to discuss a topic or a problem or a medication or something that you don't feel like you're being heard on, please email me. The email address is at the bottom. I'll be glad to reach out and talk. And although I can't, medically say, hey, this is the treatment, and I can't prescribe you treatment unless you did come to my clinic, I can help you get into the right direction. So, I mean, I've helped a patient, find the right people over in Malaysia. So I'm pretty astute when it comes to being a patient advocate. That's one thing that I've been told my whole career. So I'm going to be a male advocate and a female advocate, patients, and y'all come and join us each week. The first week, I'm going to try to release, several episodes, at least 2 to 3 episodes, because I've been working hard on getting this information out to everybody and to get it up and live and going and pushed out. So not always will it be in this setting. Maybe when I'm walking or, at work or in the vehicle or whatever, I'm just going to be real, and I don't use filters here. What you see is what you get. So y'all come join and have a great day. Thank you.